The accreditation process begins about a year before the students arrive. The American Council on Pharmacy Education is the accrediting body in Chicago, and they have a prescribed format for us to follow. We started that in June of '01. The students will be here in August of '08. The first year is preparation and paper reports. They'll come soon, April, for a site visit, and then we'll move from an applicant to pre-candidate status, with all of that being okay, in June of '08. And then we'll still be pre-candidate status until that first class graduates, so a fairly long period of time. But that proves to them that we can do everything in the pharmacy program. Then we're retroactively accredited as a program. Those students come from an accredited program, and they can set for their board and so forth. So it's a 1-year pre, and then a 4-year pre-candidate status, and then accreditation. But that's what every school goes through. I feel confident our class will be fall of 2008. Everything is geared in that direction. We've hired the faculty for that. We have space, facilities, and funding. And then it all hinges on our site visit being approved, and we'll hear about that in June. Everything at this point is on track for that to happen. First class will be 75 students. We're in the process of offering those positions now, actually. And for several years after that, it'll probably be 75 students. We're not in the growth mode. We want to become stable and really build the quality and before we think about growing. This program will be unique, we think, in several ways. One is the campus and the city make it unique. When people come here and look at our campus, they really like the culture and the atmosphere. But within the curriculum, there are 4 tracks that we've developed that make it unique, and we're receiving a lot of good information and feedback on this. The 4 tracks are pharmacy management, which will be a growth mode for pharmacy. A lot of pharmacists want management in any aspect of pharmacy they go into. The second one is managed care, which is managing the care of persons to maintain their health, or efficiently and financially sound ways to retain what health they have, the quality health they have. Third is informatics, which is all of the artificial intelligence, drug information, and things of that nature that pharmacy is being called on to provide in so many parts of the industry. And the fourth is pharmacy missions. And pharmacy missions is giving back to the community, serving the underserved, again, part of the culture we have here at Belmont, but something we also can easily tap among our pharmacy candidates and applicants. So we'll be in the community, we'll be doing things, giving back. It will be highly clinical based in that a lot of the applied curriculum will be patient-centered. A lot of this focuses on decisions and therapeutics having to do with patients. Patients can be your customers or your clients, but they're all patients to us. But based on the tracks, we want to also allow students and encourage students to take on those 4 tracks in addition to the clinical-based education. And that's kind of 2-part too. The first 3 years are heavily classroom and small group kind of learning. The last year is all off-site. So they'll be in the work site to learn what they do and to gain those competencies they need for their job. First year we'll be sharing space here on campus that already exists. That could be on this end of the campus in the Inman building. Could also be some of the larger classrooms on the southwest corner of the campus. And then there is a plan that has been approved to build a freestanding pharmacy school that will be just behind Inman, or cat-a-corner from Inman, facing Ackland, about 31,000 square feet. They'll include labs, preparation areas, compounding, a live pharmacy that's licensed, and faculty meeting spaces in their offices. My background is not too far from here. I haven't traveled. I'm born in West Kentucky, went to school in the Memphis area, University of Memphis, and then University of Tennessee. I was on the faculty at University of Tennessee coming out of school in their School of Pharmacy at the assistant and associate professor level. I was primarily in the med, at that time Johnston Hospital, trained there, managed there, and then moved there from Baxter International. At the time it was called Travenol, but Baxter now, and did some home infusion care liaison work for them. And then in 1984 moved to Nashville and began a 23-year stint with the Vanderbilt University Medical Center and served as Assistant Director of Pharmacy Services there. So my day-to-day activities still had a lot to do with students and residents, lots of contracts to train pharmacy students, and then developing an accredited residency program, and then helping manage the rest of the pharmacy services. Came here June 1 of 2007 to help initiate this program. The faculty here are 10 in number at this point in February 2008. We're very excited about that because that is the faculty we need for the first year curriculum, and the infrastructure and management team comes with that. We'll eventually be 30 people. These folks are, in almost every case, science trained to PharmD, clinical doctorate, or PhD level. Others have degrees in other areas related to pharmacy. We have all of our management team here, have all of our faculty we need to get started. And they are preparing their curriculum, their course syllabus, and all that the students need in time for a site visit and then for them to arrive. I guess my message to prospective students primarily is that I have found Belmont to be a great place to be. The culture is very wholesome, the culture is very positive, the trust level builds quickly here, the program is well funded, the facilities are wonderful, the city of Nashville is easy to attract students and faculty to, we've found. So I think that the venue and the culture is a very positive thing. Second, being a brand new program, we've been able to start with a clean slate. And even the students coming are going to help us create what this can be. So that, I think it's an older phrase used at Belmont, from here to anywhere. We're living that right now with this program.